Good morning and welcome to UW-Madison Global Health Institute's final Global Health Tuesday webinar of the academic year. Thank you for joining us. My name is Kaylin Ostrowski, and I have the good fortune of serving as the Associate Director of Strategic Partnerships and Development here at GHI, and have the wonderful pleasure of presenting today's webinar entitled Cities, Climate Change, and Health. At GHI, we are catalyzers and conveners who believe that addressing global health challenges begins with dialogue. Our work is rooted in the Wisconsin idea, a practice which takes knowledge and research out of the classroom and into real-world settings. Our Global Health webinar series features researchers and practitioners from the University of Wisconsin-Madison and around the world to highlight and examine the complexity of global health challenges and the many kinds of partners needed to address them. It is my honor to introduce our four distinguished speakers who will lead today's discussion and share their valuable experience and expertise. Each speaker brings a unique background that highlights the critical role of research and policy for addressing the interconnections of climate change, health, and urban environments. Before we jump in, a couple of quick housekeeping items. We are recording today's session, and the archive video will be available on our website at ghi.wisc.edu. And we are monitoring the chat, so please post your questions and comments for the panelists there. We have a great lineup today, so let's get started. Today, we begin by welcoming our moderator, Dr. Linda Vakunta. Dr. Vakunta is Deputy Mayor of the City of Madison and joined the Mayor's office in 2019 to assist with housing, economic development, and human services. Prior to joining the City of Madison, Dr. Vakunta was the Program Director at Heartland Alliance International, where she developed training programs to combat human trafficking. She also worked as a researcher on a CDC-funded grant studying opioid use among African American women in Madison. She was the founding executive director of Project 1808, a nonprofit that helps communities in Sierra Leone through educational partnerships and youth empowerment. And she is a longtime host of 89.9 FM's Pan-Africa radio show. Linda is a Badger, an alum, and holds a PhD in environmental studies, a master's degree in rehabilitation psychology, and a bachelor's degree in psychology from the University of Wisconsin-Madison. She is also a member of our GHI Board of Visitors. Welcome, and thank you, Linda, for joining us. Next, we welcome Marta Rofín. Marta is an architect and urban planner with long professional experience in master planning, urban management, and the incorporation of health in urban development. She is also the founder and CEO of Healthy Cities and oversees the postgraduate course, Urban Planning and Health, at the Polytechnic University of Catalonia. In her work at Healthy Cities, she develops urban health strategies, impact assessments, research and training projects, and developed the Healthy Cities Generator assessment tool. She has worked in both public and private sectors, including drafting the City of Barcelona's master plan. She is the author of several publications, including the Guide for Incorporating Health into Master Planning. Welcome, and thank you for joining us, Marta. Next, we welcome Carlos Moreno. Carlos Moreno is a distinguished Franco-Colombian urban planner and professor residing in Paris. He is best known for pioneering the 15-minute city concept, which promotes sustainable, human-centric urban living. This concept has been embraced by mayors and international organizations and evolving into a global movement for more sustainable cities. In Paris, his ideas have been embraced by the mayor, contributing to its transformation. Serving as a scientific advisor to various international organizations, he is recognized for his contributions to urban planning. He is a fellow of the American Academy of Housing and Communities. As a professor at the IAE Paris-Sorbonne, his internationally recognized work has earned awards such as the Obel Award, UN Habitat Scroll of Honor, and the Global Leadership Award for Sustainable Development. Inducted into Sigma Z in 2023, his books have been translated into multiple languages. Welcome, and thank you, Carlos, for joining us. And lastly, we welcome Eduardo Santana. Eduardo is the Director of Museum of Environmental Sciences and Emeritus Professor at the University of Guadalajara. For over 2 decades, he has been adjunct professor and visiting scholar at UW-Madison, where he obtained his bachelor's, master's, and a PhD in wildlife ecology and zoology. He was born in Cuba, grew up in Puerto Rico, and has lived in Mexico since 1985. Eduardo created undergraduate and graduate programs, academic institutes, civil associations, natural protected areas, and novel local governance mechanisms for watershed management. Eduardo co-created the City and Nature Jose Emilia Pechero Literature Award, the Socio-Environmental Film Award, and the International Colloquium on Biodiversity, Natural Resources, and Society. Eduardo has worked with UN Habitat on the New Urban Agenda and SDGs, participated in biodiversity COPs, supported indigenous land rights in Western Mexico, and helped design Cuba's conservation program for the World Wildlife Fund. Welcome, and thank you for joining us, Eduardo. Now, without further ado, I am pleased to welcome Linda as our moderator and begin today's discussion. Thank you.
Good morning. Thank you so much, Kayleen. It's such an honor, and I'm very excited for this conversation. As someone who has worked in local government, it's a dream to sit with experts of this caliber today, and I'm excited that all of you have registered to hear from them. The other thing that I'm very excited why you all, the audience, are here is because change starts with you. When we say cities is people, and each of you lives in cities. And so hopefully you will hear something from here that will spark you to engage in conversations, in actions, in policy. There's never there's always an unlimited ways to engage when it comes to climate change and cities. I just wanted to give just a little brief overview of the city of Madison's effort. I won't go in depth because I'm actually not the expert. We have a sustainability unit, which has several staff who are experts, and they can talk to you about our sustainability efforts forever. But one of the things that I wanted to point out that I'm excited about how we at the City of Madison have engaged in this, and much kudos to our Mayor Satya Rhodes Conway, is that we started from the inside, right? We started from the city and we moved outward. And what do I mean by that? When the mayor came into office in 2019, tackling climate change was one of her main priorities. And how did she demonstrate that that's a priority? She put staff and she put resources behind that. So when we came, there wasn't a sustainability unit, but now we have a sustainability unit with a director and several staff members. Also, the city has always had goals towards ensuring that all our operations are utilizing renewable energies by 2030. And so the mayor has been aggressive in that. We have bought electric buses, which is very exciting for our BRT. We have gone after so many grants because cities alone do not have enough money to tackle some of the climate change issues. So we must go up and look for money, and that takes a dedicated effort. And also we've been interacting with the community, right? So we're putting in policies in place about that encourages large real estate commercial buildings to measure their utility bills and to think about utilizing renewable energy. And so there are many things. There's a link that I will put in the chat on some of the things that the city of Madison is doing. We have a sustainability plan, which was just approved last year by the Common Council. So I just want to say here at the city of Madison, we're taking it very seriously. Our mayor is a leader when it comes to these conversations. She was also at COP, representing the United States when COP was held in Dubai. And so, yes, here in Madison, we take it very seriously. So I am excited to introduce our first presenter, Marta. She will present. We will do a Q&A at the very end. So Marta will present, then we will hear from Carlos, and then we will hear from Eduardo, and then we'll take some questions from you all. So I will turn it over to Marta, who is doing some very exciting work. Welcome, Marta.
Thank you, Linda. Thank you so much. Good morning, everyone. Good afternoon, actually, from Barcelona. First of all, well, thank you very much for the invitation. It's a pleasure to be here and share this, I think, very much needed webinar with experts like Carlos and Eduardo. So, yeah, maybe we can move to the next slide, please. Yeah, if we are going to talk about cities, climate change, and health, I think that the first thing we must all be aware of is what we mean when we talk about health. No? As the WHO defines health, is it clear that we are not just talking about avoiding diseases, but about achieving a state of well-being enabled by our cities and our environment. So next slide, please. In this sense, it's important to highlight that almost 90% of our health, almost 90%, which is a lot, lies outside the healthcare system and is related to our genetics, behavior, environment, or social circumstances. Even so, despite this such a strong evidence, health budgets are not, maybe the previous one, the health budget are not usually distributed according to those different causes. No? In general, the healthcare system focuses more on treating the consequences rather than addressing the causes. And it is mostly a reactive and not a proactive system in general. Yeah, next slide. But the truth is that this almost 90% of death in Western countries are due to non-communicable chronic diseases, especially 4 of them. You can see here on the image, and they have a common factor. They are very closely linked to lifestyle factors. In most cases, these diseases are absolutely preventable. We can avoid those diseases. So, yeah, next, please. Taking all this into account, it becomes essential to talk about cities, because it turns out that 75% of that 90% of health outside the healthcare system is related exactly with the environment in which we live our lives. So the environment that we plan, that we design, or that we manage, whatever your role in the society is, has an impact on how we move, the air we breathe, and even our state of mind, our mindset, also our way of thinking. So it has a strong influence to our well-being. So next, please. There are several models that have explored this relationship between the environment, understood as an ecosystem, and our health. Factors such as air quality, noise, access to green spaces, heat, or lack of physical activity are responsible for a large number of pathologies. But next, please. It's important to highlight that all these factors have a significant geographic component as well. In fact, the combination of urban factors such as density, accessibility to green space, or green space distribution, or connectivity is directly related to the prevalence of a number of diseases such as cardiovascular diseases, overweight, or obesity. So it's important to consider this, the geographic distribution of this. So, and all this, next please, all this has a very perverse effect on health inequalities. Normally more vulnerable neighborhoods often have urban designs that exacerbate these health disparities. That's why it's important to see urban planning as a tool to reduce health inequalities. Yeah, so I could expand more on this, but I have just limited time. So obviously health requires a cross-cutting approach. next slide, it's about the health in all policies approach. Of course, health goes much beyond the sectoral policies, but it's important to consider that the big influence that environment and urban policies has on health in general. We can actually create health through urban planning. We have this power in our hands. Of course, it's important to consider health in food and culture, in education, but there are so many things related with the urban environment, with the other urban planning conditions, that we cannot forget that. Yeah, so when we talk about the healthy cities, next slide, please. We are not talking about a city full of hospitals, but quite the opposite. We are talking about a city that promotes an active lifestyle, connection with nature, and that facilitates social relationships. From this point of view, urban planning becomes a generator of health and well-being. So it's important to consider that when we work on planning and designing our cities, we are not only designing streets and buildings, we are designing the future of our health. So we have been working from this perspective for many years now. Next slide. Maybe some of you are familiar with the concept of determinants of health, defined by the WHO as this set of personal, social, political, economic, and environmental factors that determine our health. So we like this approach of the determinants of health, but we try to understand how and to identify which of those determinants were really very much linked with the urban environment. So we like to talk about the urban determinants of health. The next slide, it's a kind of summary of the different factors that we define the urban determinants of health as those factors that can be modified with an urban planning or with an urban design, and that has an impact on health, either directly or indirectly through influence other determinants of health. I mean, more greening, more connectivity, or more proximity to greening, it means reducing air pollution, but also at the same time, it increases physical activity, which brings to less incidence of cardiovascular diseases or obesity or diabetes. So on the next slide, I show a summary, a chart showing one of our study's conclusions, where the relationships are identified between those 20 urban determinants of health and 30 health indicators of physical, mental, environmental, and social health. So we identify those 20 factors, those 20 urban determinants, 20 aspects of the environment that can be changed or modified, and that has an impact on this physical, mental, social, and environmental health. This is essential, this is crucial, because having this information, we can work on both sides. We can plan our cities and understand what the impact on health is going to be, but also on the other side, if we have a specific goal in mind, if you know that your cities and your neighborhood has a specific disease, you know what you should focus more on your urban planning, on your urban design to tackle exactly the health that you want. So, yeah, next slide, please. This is a little bit more information about those 20 urban determinants of health. Some evidence is noteworthy, such as the fact that access to green space reduces the incidence of cardiovascular diseases by 16%. 16%, it's quite a lot. Or even the post-operatory recovery is faster for patients with a view of a green area. So can you believe that just viewing a green area, it has a strong influence on the post-operatory recovery. So the impact of greening is huge, not only for physical, but also for mental health. So yeah, next slide, please. This is where actually I wanted to get to, because we have enough knowledge to take all this into action. We know a lot, and sometimes we have the feeling that we need to exactly build the bridge between what we know and what we do. Sometimes researchers and university spend a lot of time doing research, but the point is how to bring all this knowledge into action. And now I feel that we have enough information, and also we know how to do it. So, and we can begin to plan with health in mind. We can guide urban plans based on health priorities and also evaluate the health impact of our cities to, among other things, see the economic impacts of our decisions. This is a real example from Barcelona, where we were working, where we exactly evaluated both the health impact of the urban planning transformation, but also the potential savings in healthcare cost. I mean, if we improve our environment and we estimate that this is going to have an impact on cardiovascular diseases or obesity or respiratory diseases, for example, we can estimate how much money we can save in our healthcare system due to those changes in the environment. And this is exactly the kind of things that we have to start to bring together both perspectives from health, from planning, understand the links, understand how they relate each other, the links between any changes in the environment and physical, mental, and social health. And maybe next, I will end up with a message. Health is a very powerful tool for designing our cities. And the city actually can become a great tool for health. So just let's not miss this opportunity. Let's use this knowledge to improve our planning, our design. And it's in our hands. We have the knowledge, we know how to do it, so let's do it. I think that's it. Thank you. And back to you, Linda.
Thank you so much, Martha. I love that presentation so much because twice you said, we have enough information now, let's do it. You know, we do like to research things until we can research it no more. So thank you so much for saying that. We have enough information now. Let's do it. Let's put the money where things needs to be done. The other things that I love so much from your presentation is that 30 minutes walk 5 times a week can do a lot for our health. So I need to remember that for myself. And audience, I hope you remember that too. And you also said just viewing greenery is very important. It's interesting because when people come into Madison, they're like, Madison is so beautiful. I wonder why. But it's because we don't joke about our greenery here. So when you come into our city, it feels good. It feels great. Thank you so much. I really appreciated that. We're going to move on to the next fabulous presentation by Carlos, if Carlos is ready. And audience, feel free to put questions into the chat. We can also just take by hands later. Okay, welcome, Carlos. Over to you.
Thank you, Linda. Thank you, Linda. Thank you, Marta. Hi, Eduardo, and everyone. Greetings from Milan in Italy today. I am very, very happy to share with you my thoughts on this crucial topic, climate change, cities, and health. My research work is focused with my team at Sorbonne University in Paris for understanding the impact of this intertwinement, climate change, health, and the urban shapes. I have developed this concept, the happy proximity, very well known as the 15-minute city. This concept has become very popular worldwide. However, I said in permanence in all my different lectures that in the 15-minute city concept, the less important point is the number of minutes, 15, 10, 20, this is no matter. Question is, in fact, to transform radically our urban or territorial lifestyle, urban for the high density zones, territorial for the medium and low density zone. To transform as well our work style, our computer style, just in a few words, to live differently. And in fact, we don't have a choice. Today, we have been living in a urbanized world. More than 50% of the world population today lives in cities. And the impact of climate change is totally related to the development of this massive urbanization in the last 40 decades. This is no more a climate change. This is a real climate emergency today. In all continents, this is really the Anthropocene era. This is our lifestyle. Mineral cities, traffic jam, overcrowded streets, roads by the use of the individual cars, overcrowded public transportation as well, the new urban diseases, pandemic crisis, the unhuman places for shopping. And today we have, in fact, this particular situation for humanity. We have accepted to live in an unsustainable world with the unsustainable cities. And of course, we have been today the unsustainable life. Sustainability is not only a question of the ecological positive impact. Sustainability is, in fact, 3 pillars: and positive ecological impact, and as well an economical and social positive impact. This is the sense today of our commitment. The climate crisis, in fact, has been generating this holistic, systemic, crisscross impact worldwide. We have today a lot of different diseases. Marta explained very, very clear the different particular conditions. And I want to insist in these 3 modern threats related to the massive urbanization. On the one hand, the urban obesity with the development of the urban sprawl, informal settlements, gentrification, long distances. The second one, the car obesity. More and more and more and more big cars. And the third one, the embodiment, the obesity for people, this global epidemic related to our lifestyle, junk food, less physical activity, the permanent use of cars. We need, in fact, to transform radically our lifestyle if we want to fight with success against this triple obesity. Pollution is today one of the most relevant sources of diseases in cities. In the 21st century, in our cities, we have more than an economical inequity. We have generated 2 new injustices: a spatial injustice for people that live more and more far away, with the overcrowded buildings, in the a strong gentrification process, more for people were constrained to live more and more far away without services, and we have been creating a strong car dependency for these people. And the temporal injustice. This is one of the sources of social exclusion, for constraining people to spend 1 hour, 2 hours in the global south until 4 hours for a daily road trip. We have identified these 21st times the social vulnerability. The temporal and spatial injustice is related to the development of the urban segregation and gentrification. This is the classical digital map of a city. This is the case in France, in a really great city in the south or west of France. At the center of a city, the life is in blue. We have a lot of different services. 20 kilometers, 30 kilometers far away, the life is in red. No more services. Just a roof, a four wall, a car dependency, and people, in this case, are in fact one of the factors for spreading this urban pollution of cars. We have today 5 key elements for fighting against these difficulties for living in a healthy city: air pollution, noise, the loss of natural spaces, the absence of physical activity, and the rise of temperature. In reality, today we need to define in what kind of city we want to live in. As mayors, local governances, citizens, stakeholders, private sector, we need to do a choice. With the urban and territorial proximity proposed by the 15-minute city, the 30-minute center, the X-minute city, we want to reconcile sustainability and quality of life. This concept is no more a theoretical point of view. I have started this research in 2010, 15 years ago. Today, a lot of mayors around the world have embraced this concept. The International Organization of Mayors, the International Organization of Countries as UN Habitat. And we have in the 5 continents a lot of different nicknames for developing these implementations. Recently, in November 2024, in the 12th World Urban Forum, the final declaration said placing proximity and circularity at the center of urban development is totally necessary. It all starts at home. We need local action for sustainable cities and communities. Climate change, loss of biodiversity, urbanization, in fact, are intertwined in this systemic impact. Recently, in Colombia, in Cali, in October 2024, the COP16 biodiversity said we need to live with this notion: one health. Cities, people, society, plant, animals, environment are totally related. Jane Jacobs said in 17th, when she coined the concept of living cities, the point of city is in fact to have a multiplicity of choice every time, everywhere, without having a car dependency. This is today the essence of this concept: to love our neighborhood, to develop a proximity for everyone, to a stronghold against segregation. This is not only a question for reducing our carbon footprint. This is not only for creating more social interactions in our neighborhood. This is to develop as well a new urban and economic model for localizing employment, for developing shorter circuits, for developing more local activities. This is the 8 principles of this concept: proximity to essential services, organic density, mixed use, public space with high quality, efficient public transportation, active low carbon mobility, inclusivity, and ubiquity for using technologies. Proximity today is not only a new lifestyle. Proximity is the best resilience. When we have the crisis in Spain and Portugal recently, the power outage, the global fall of electrical sources, proximity, in fact, is the best resilience. This is the sense of this word that I have proposed recently in Cairo, proxilience, proximity as a resilience. We wanted to develop this polycentric organization for every time, everywhere, to access to these different services, to live, to work, to supply, to care, to learn, to enjoy. This is not a magic wand. This is a way for creating, for generating the new, I lost my, I'm so sorry. Up. This is a way for generating more services for increasing our quality of life. My personal well-being, my social well-being with my neighbors, my work colleagues, and my sustainable well-being, my CO2 footprint, for developing this social mixity, functional mixity, and in a polycentric city. We have today a lot of cities around the world in the different contexts for developing this concept. I want just for finishing to highlight the development in a city in Paris. The most important point is, in fact, when in November 2024, the city of Paris has voted the new master plan, the bioclimate Paris local urban plan, available for the next 10, 15 years. Nature as a common good, affordable housing, low carbon neighborhoods, environmental health, urban identity, hyper-proximities, and resilient city. This is the sense of the 50-minute city or the challenges of proximity. This was our proposal when we have proposed this concept in Paris, to develop an ecological, economical, and social positive impact. During the Olympic Games worldwide, we could observe this amazing transformation of Paris. This is the triumph of a vision. This is the triumph of a vision by this happy proximity, to give places for people and more for cars, to transform the iconic squares, to ban cars from the motor highways along the Seine River, for recovering these places for people. This is today the big transformations for offering the natural resources, the Seine River, for hiding the swimming pools in the Seine River, for making the schools the capital of our neighborhoods, for open the schoolyard during the weekend, for banning cars in front of schools, 200 schools, 200 new mini parks, for removing asphalt from the schoolyards, and for creating this vegetalization, for offering this climate resilience, to open the different places for having the multi-purpose function, the multi-uses, for generating more livable neighborhoods in the different places in the city. We have developed the Rue aux Écoles, Street for Kids. This was the project Paris Breath. Paris Breath was just to close the two sides of the streets without transforming with more equipments. And after that, we have developed the program for offering a lot of different equipments in this street for kids. This is today the presence of Paris of this new urban policy. But this is not only a question of walkability or bikeability. We need to go beyond that. And for going beyond that, in fact, this is the economical positive impact, to offer places for hosting entrepreneurship, local commerce, local shops, local circuits. The city of Paris has created the commercial property of the city of Paris for managing places in order to attract more entrepreneurships. The question of gentrification is a good question, but the city of Paris was for a long time gentrified. In the west of Paris, 2.2% of social housing. In the northeast of Paris, 42% of social housing. We have decided, in fact, to transform for developing affordable housing in the rich districts in the west of Paris, to transform the commercial 100 corporate places in social housing and mixed uses. We have created new centralities in different places in Paris, 50% of social housing, 20% of middle-class rent, and 30% of the most people owner. And this is today a reality. I will finish with these 5-minute places. This is the Paris of 5 minutes bakeries for kids. Thank you so much.
Wow, merci Carlos, ça c'est vraiment magnifique. Thank you. You gave
Please,
us
my pleasure.
you gave us a library. We will have to come back and listen to this lecture again. So much that you've offered us in 12 minutes. Proxilians is what I will remember. Proxilians. Merci, merci. We will turn it over to Eduardo, who will give us another fantastic presentation. My word. Audience, I hope you're just loving everything you're hearing today. And again, remember to put your questions in the chat, or when it's Q&A time, I can just call on you. So I will turn it over to Eduardo.
Thank you. I will read my statement so as not to go over my time. But first, thanks to the Global Health Institute, to Jorge Osorio, Kaylin Altrosky, Karen Newcomb Katie Newcomb for this invitation. And at the University of Guadalajara, we have been designing and constructing a natural history museum that has an unusual mission: understanding the city and inspiring the conservation of nature that sustains it, to catalyze ecological and social transformations for the benefit of our community. So those of us working in environmental science museums are facing a communicative dilemma. If we limit ourselves to only presenting the most accurate information about the deteriorating and often irreversible trends of global change, we might as well place on the frontispiece of our museum Dante's words at the entrance of hell: "Abandon all hope, ye who enter here." Scientific evidence is unambiguous. Humans are generating such large-scale planetary changes that we have become the equivalent of the Chicxulub asteroid that caused the mass extinction that ended the age of dinosaurs. I will share some of the concepts and ideas we use for our museum narratives regarding environment, city, and health. But when I began shaping the remarks for today, I realized that the triad of this webinar, cities, climate change, and health, actually rests on two deeper foundations: agriculture and ecology. Together, these 5 forces participate in a single long-running process of cultural and social biological coevolution that binds the microbes within our guts to the energy flows and the biogeochemical cycles of the entire planetary biosphere. As in cities, our bodies were and are created by cooperation. We were never and never will be individuals. Each of us is a meta-organism. For every human cell, we host at least one microbial cell and harbor more bacterial and viral genes than those of our own body. The microbes in our microbiomes are our biochemical partners. They are not passengers. They remind us that cooperation, from Lynn Margulis' symbiotic origin of the eukaryote cell, endosymbiosis, through the mutualism of our gut flora, all the way to human social organizations, have been a far more powerful shaper of life and of civilization than competition, predation, or parasitism. A lesson we should not forget in these very troubled times. Scaling up from our bodies to the landscapes where we dwell brings us to agriculture. Neolithic, or first agricultural revolution 12,000 years ago, transformed hunters and gatherers into food producers by independently domesticating staple crops in multiple centers: wheat in the Fertile Crescent, maize in Mesoamerica, rice in Yangtze and Ganges basins, among others. Although in Yuval Noah Harari's sardonic verdict, agricultural revolution was history's biggest fraud, Wheat domesticated us, not the other way around. Yet without that fraud and without the later fossil-fueled green and gene revolutions, no large cities would have emerged. Agriculture still mediates our health every day because diet fashions what nutrition scientists now call nutritional exposome, the continuous stream of molecules that program gene expressions, epigenetic marks, and microbiome composition. Food is increasingly framed as information rather than fuel, a perspective driving personalized nutrition studies that weave genomics, behavior, and environment into predictions of disease risk. Thus, your dinner plate is the interface linking your kitchen with planetary systems of land, water, and carbon. When we think of health, we think of medicine as doctors, nurses, hospitals, drugs, surgery, needles, syringes, high technology medical equipment, and sterilized spaces, among many other components. Health is linked to another word, disease. However, philosophers, ethicists, disability studies scholars, and patient groups, among various other groups like members of the World Health Organization, explicitly reject value-neutral definition of disease. They reclassify or publish alternative accounts in different ways. Disease concept must encode, they say, social, ecological, and behavioral causation. Strictly biological definitions are thus insufficient for modern chronic and especially climate-linked conditions. They are socially contested conditions that should no longer be classified as diseases under the old biomedical lens. Examples of chronic pain or neurodiversity or gender identity have been reframed and should be treated as variation, not disease. Health and disease, as well as climate change and biodiversity loss, are linked, I think, mainly to two things: human suffering and extinction of species. To reduce human suffering and prevent further species extinctions, we must go beyond technical solutions or technocratic solutions and construct a new ethical framework, as we have done in other critical junctures of history. And it's been millennia that we have been constructing different ethical frameworks. If we were asked in a game of trivial pursuit to name the organism that polluted the atmosphere, altered the climate, and drove thousands of species to extinction, many would mistakenly answer humans. For those of us who love nature, the correct answer is unsettling. 3 billion years ago, Earth was dominated by anaerobic life, which thrive in the atmosphere devoid of oxygen. The emergence of cyanobacteria and their invention of photosynthesis generated a new poison, oxygen, which massively contaminated the atmosphere. This toxic oxygen caused global climate change and the extinction of over half of the planet's species. Cyanobacteria did not know they were causing extinctions. We could call this area the cyanobacteriocene, just like we call now the Anthropocene. We, however, do know that we're causing extinction. The great oxidation catastrophe that I just described also allowed for the evolution of aerobic respiration, the rise of complex multicellular organisms, and the new life emerged, including us humans. We're here thanks to that mass extinction and that mass climate change and poisoning of the atmosphere. Thank the cyanobacteria for your existence. Will we become the cyanobacteria of the future? Will some future species born in the wake of our destruction look back and thank us for the extinction that we caused, including our own, which made their existence possible? Remember that all mass extinctions in the Earth in history, all 5, rebounded for there to be more biodiversity in the future. So should we be that like those philosophers that say that maybe the benefit of bigger biodiversity in the future justifies the death of today? When life on Earth consisted only of unicellular microorganisms, there was no pain, no suffering, no ethical or moral principles, and no concept of good, evil, or of human rights, or rights of any kind. Bert Callicott proposes an ethical principle that arises with humans and must be anthropocentric, frame spatial in temporal limits of affection and love. This should lead us to apply ethics and morality to save lives of those organisms beyond ourselves who accompany us today. That is to halt the accelerated anthropogenic climate change and maintain that Holocene climate conditions from which we evolved and emerged. The contradiction is only apparent. Being pragmatically, ethically anthropocentric will lead us to an ecocentric care of the entire biotic community of which we are part. Thank you.
Thank you, Eduardo. I must say, you got me questioning my own morality there. Thank you for posing those philosophical questions. We appreciate it. All right, so we have about 10 minutes for Q&A. So I'm going to open the floor to our audience members. If you have questions, please try and raise your hands. Katie is also going to be helping keep an eye because there are quite a number of you on here. So, do you have any questions for our presenters? And if I don't see your hand, just jump in. But I am scrolling through to make sure I don't miss anybody. Professor Jonathan Patz, you got a question?
Yeah, thanks for these great presentations. I'm just wondering where electrification and computer tools come into play as far as designing more sustainable cities.
Who wants to take that?
Carlos Moreno will take that.
I almost said Maria.
I don't understand exactly the question. Electrification in computer. What do you mean exactly?
Oh, so for making smart
Electrical
cities,
vehicles, power grid.
well, yes, yeah, electrical vehicles, trying to remove need for fossil fuel through electrification. And then the additional question is, the use of computer programs and making flow of traffic better, or lights out, things like that. The combination of computer technology plus electrification.
Yeah, I could. I'm trying to evoke this point. The question of electrification is in fact the massive use of silicium of computers with algorithm for developing more automation. The electrical vehicles, in my point of view, is not necessarily the solution for better living in the city. Usually I said that a traffic jam with electrical vehicle is a traffic jam. The electrical vehicle are in fact one of the most relevant producers of fine particles, in particular because the center of gravity by the batteries has produced a more friction between brake and tires in the road. The production of fine particles by electrical vehicles is really important. But at the same time, we need to change from the fossil fuels, from the diesel cars, towards a more efficient vehicles. The question is, in what conditions we need to use or not a car? The problem is that the majority of people that use a car is just for shorter distances. In Europe, 52% of the use of a car is for the distances less than 6 kilometers. This is a nonsense. this is the real question. Computers, the question is the energy consumption of artificial intelligence. This is a real big problem today.
Thank you, Carlos. We have Jamie and then Janet. Jamie.
Good morning. I just wanted to comment that maybe a subject that's been a little bit too much implicit, perhaps in the conversation, is that as cities evolve and climate changes, also the distribution and abundance of insect arthropods and other animals like rodents and birds change in the cities, and these living beings are also associated with health, in both in terms of being not only nuisances, but also vectors and reservoirs of disease. Over. Thank you.
Thank you, Jamie. Janet.
Hi. Speaking of things that you can actually do, about 4 years ago, I decided to take action and I started a car share. We now have 13 drivers driving 3 cars, and it's terrific. I don't even care for cars, and by running a car share, we all drive quite a bit less. We look at other modes of transportation. Certainly is a big money saver, and it's a space and resource saver in having, rather than 13 cars, that we have 3 cars. The American way is to have a car for every person that just sits all the time. So how can we move along with that? How can we expand that? How can we get people out of their private car mentality?
I will let some of our speakers speak as well, but I would say for Madison, the mayor has prioritized public transportation, working with the community to ensure that it's accessible, it's proximate. And having other modes of transportation, and so like Madison is I believe we're platinum as a bike city, and we're gold as a walkable city. So you have to make those other modes of transportation easy for your city. But I'll let some of our other experts speak into that question. How do we encourage more ride shares or utilization of other modes of transportation? Anybody? Marta, Eduardo, Carlos?
Well, I was gonna go ahead, Marta. Go ahead.
No. See? Okay. No, for me, I think that something we have to consider when we want to talk about active mobility and how to improve of active traveling in our cities is to understand that on the basis of the mobility pyramid is where the things are located. So where are the hospitals, where are the schools, where are houses, where are shops? So depending on how far is it, you cannot pretend people go walking. So I think if we want to move towards a more active and sustainable mobility, we need to start planning our cities with this goal in mind and start placing the things on the right place. So we need to work with this proximity idea. We need this 15 or 20 minutes concept, but also to working with walkability and proximity, housing quality. I mean, how can we plan from the beginning? Then once the city is already done, it's hard to push people to walk if the distance is high, or maybe it's not appealing, if the walkability is not right. So I think we should start. Actually, I think that the mobility often is a consequence of the shape or the design of the city. So so every time that we have the opportunity to take part into a planning process, every time that your city is planning for a new development, for example, take this into consideration and think, how do you want people to move there? And then that will help you to decide where to place the different facilities or housing developments or parks, green areas, or whatever. So for me, it's about thinking in a holistic way, not separately, not working on silos, not working on different departments, mobility on one hand, and greening and housing on the other. We need to understand that we need this holistic and transversal and multi-sectorial planning. There was a question on the chat asking how often health people or health sector is involved in urban planning, and I would say never. It's very few cases, but we really need that. We architects and urban planners, we understand about cities, but we need health sector, or doctors or public health departments, they understand about people. And if we pretend to plan cities for people, we need both. We need city experts and people experts, no? So we need to combine both disciplines.
Okay.
Yeah.
Thank you, Maria.
Regarding to
Martha,
that,
sorry.
about the holistic thinking, I was just going to mention that the thing about these piecemeal answers is that we run into what's known as Jevons paradox. We end up being more efficient. We end up reducing per unit energy consumption, but then everyone starts using it more, so we end up using more at the end. And so the UN Habitat did a study of cities and how they confronted the pandemic. And it came out that Vietnam was showed some of the best results, basically built on community organization for many different things, and that includes mobility, but working at the neighborhood level, one thing, and two, high levels of trust. Even if there's a lot of corruption in Vietnam, still the level of trust at the different scales of political participation was very important in the citizenship being able to work towards confronting the pandemic. The issue of computers that Jonathan mentioned, and hi, Jonathan, right now the US is estimated that 4.4% of the electricity is used by artificial intelligence programs, and that's expected to increase to 15% of the US consumption by 2028. These are rough line figures because there's no data and they're very tight about it. But so it brings additional problems, just like electric cars are bringing higher particles that affect the lungs, sometimes worse than toxic fumes.
Thank you, Martha. Thank you, Eduardo. We will hand it over to Caroline now. Thank you.
Great. Thank you so much, everyone. What a fantastic discussion. Unfortunately, that is all the time we have for today. Please join me in thanking Linda, Marta, Carlos, and Eduardo for sharing their invaluable insights and perspectives today. I'd also like to thank all of you for joining and sharing your comments during the discussion. Be sure to visit our website, ghi.wisc.edu, to learn more about our webinars, ongoing activities, and find today's archived video. I hope everyone has a wonderful rest of your day.